Hey there, my name is Sean Galt. I plan to do this tomorrow, but as I discuss this topic, you'll realize that working in the medical field and especially doing what I do in consulting, things change rapidly. So unfortunately, I'm going to be on a plane tonight to Detroit, Michigan for client meetings the next 3 days that I did not plan to partake in. So I want to talk to this group about the hospital revenue cycle. We all go to the hospital and we all are patients and we all come out of that process with documents like this, which are medical bills. And honestly, for most times or most part, people just pay them, and hopefully their insurance covers the rest. It's obviously a process that is undertaken once you go to your physician or go to the dentist or go to a hospital to ensure that things are coded correctly. I kind of want to walk you through that in a couple steps. The first step is obviously the admission process, and that is you going to the doctor or you going to the dentist, and there's a process associated with that, the admissions of you as a patient. That includes eligibility. That includes something that is, sounds pretty simplistic from the outside looking in, but do you have insurance? Do you have to pay cash? Or is that something that has to be pre-authorized? As part of that eligibility process, in regards to that authorization process, there's an entire division within a hospital or doctor's office that will verify your eligibility. They'll reach out, they'll make those calls, they'll verify that A, you have certain levels of coverage, what is your responsibility, what is the insurance responsibility. Most times, unless it's an ER type scenario, they will share that with you in advance. I personally went through some major surgery 2 years ago, had plenty of data, plenty of information. I knew exactly what my costs were going to be, knew what my insurance was going to cover. And of course, there was differences in that process when I got the bill. Fortunately, it all worked out. In addition to you being admitted, there's a patient access responsibility or patient access process that's setting you up as a patient, and that's making sure that they have your social security so they can bill you. They have information associated with being your medical history and things like that. And so that's really the admissions process. That's an important process in the revenue cycle process, in the collections, the running of a hospital. The next step is really the treatment process. When you think about treatment, you think about what is the process and what happens in that process. So they're medically taking care of you. They're focusing on, hopefully, the highest level of patient care. They're also focusing on, in some ways, what's that going to cost. And the way that happens in the revenue cycle process is that there's a charge capture. This is a coding system. So in the last 15 or so years, a ton of money has been spent by providers to focus on capturing that data and creating a set of codes, currently referenced as ICD-10, which is just a system that says if they're treating you for this medicine for a broken arm or a broken this, it's coded as a specific code. What that does during that treatment process is tracks everything. If you went to the doctor again and you got one of these great statements or billing statements, you will see once again that it doesn't give you a ton of detail, but it does give you some codes as a reference point. Not that they mean anything to you or will mean anything to me, candidly. That process is critical to the collections of money for a hospital to run. Hopefully, things go well and you'll be discharged as a patient. And when you're discharged, the process of billing and the claim management process occurs. This happens in two ways. One, billing you and billing your insurance, again, with all that coding that is provided. They focus on what is billed to you, what's billed to the insurance, and then what can you focus on, or what information is when you receive that bill, to ensure it's accurate. There's also a process behind what we call the EMR, the electronic medical record process, which is tracking all this information. That is also tracking information to the hospital's financial system, normally called an enterprise resource planning system. This is their payroll systems, their HR systems, their procurement systems. And so every syringe that was provided to you, or every medicine that was provided to you, purchased at some point, and that's being tracked on the hospital system or the provider system from a billing or from a process perspective. So hypothetically, if you're being charged $5 for something, the hospital paid 10 cents for it. But that gives you an idea of the beginning process of that process. Once you're discharged, things go really well and you're all healthy and you go home, and which is great. You move on to the billing and collections process. And again, that was the process of you getting an invoice, the provider or the insurance company getting an invoice, you being responsible for your portion. And in most places, consumers pay faster than the insurance companies. It is electronic, but insurance companies in general, when that's the process, will work to question charges and validate that certain things were provided. We as consumers generally just pay the invoice and assume that it's correct. All of that process usually takes, hospitals normally don't collect money in the revenue cycle process for 120 to 400 business days. So it gives you an idea of the slow process and why hospitals close or hospitals get bought. And they always strive to focus on the improvement of these processes. Something, honestly, that I do for a living. We go into hospitals and we focus on improving the revenue cycle collection process. And we do this, honestly, from a perspective of if we collect $100 and you give us $10, or we have a group of people that are calling to collect from consumers, the truth is we make money in that process. And it really helps the health system or the hospital or the provider really focus on ensuring that they're focusing on providing the highest level of patient care, but at the same time are really focusing on collecting that money that they're owed from the consumer and or the insurance company, not the insured. That's a high level process of something that happens day in and day out from a hospital, referred to as the healthcare revenue cycle process. From a financials perspective, but also again allowing the clinician, the nurse, the anesthesiologist, the ER doctor, really to focus on providing the highest level of patient care. As that occurs, these all processes should happen behind the scenes. And so that's really the revenue cycle process. I appreciate your time and I appreciate you listening.